الرحيم. الأكزيلاري نيرف يعتبر برانش من البوستيريور كوردال بريكال بليكسس نيرف روت 5 و6. يعتبر الموتور سبلاي بتاعه عضلتين بس، التيرس مينور، الشولدر اكسترنال روتيشن اكستنشن اند ابدكشن هوريزونتال ابدكشن، والدولتويد anterior deltoid shoulder internal rotation and deflection and horizontal adduction. posterior deltoid اللي هي shoulder external rotation extension horizontal abduction، والacromial fiber اللي هي powerful shoulder abductor. الأكزيلاري نيرف يعتبر becomes upper lateral cutaneous nerve of the arm, supplies the skin covering the lower half of the deltoid and upper part of the long head of the triceps. Lower half of the deltoid and the upper part of the long head of the triceps. Cause of injury can injury due to dislocation of the shoulder or a fracture surgical knock of the humerus, square shoulder from deltoid muscle atrophy, sensory loss over the lower half of the deltoid. الريديال نيرف ده العصب الثاني، برانشز من البوستيريور كورد of the brachial plexus, nerve root 5 و T1, exit axilla by the triangular interval, travel down humerus in radial groove. At the elbow, the radial nerve braces the lateral muscular septum anterior to the lateral epicondyle and pass under the origin of the extensor carpi radialis brevis, then divided into superficial and deep branch. الموتور سبلاي بتاع الراديال نيرف 4 عضلات: triceps, elbow extension, anconeus elbow extensor, brachioradialis, elbow flexion, and especially in mid-prone position, supinated of the forearm. الراديال نيرف كم عضلة: extensor carpi radialis longus, wrist extension and radial deviation, extensor carpi radialis brevis, wrist extension and radial deviation, extensor carpi ulnaris, wrist extension and ulnar deviation, extensor digitorum 2 ل 5 digit extension في الميتاكاربول والانترفلانجيال والريست، extensor digit minimi 5th digit extension at metacarpal interphalangeal, extensor bolus longus first digit extension at carpometacarpal interphalangeal, extensor bolus brevis first digit extension at metacarpophalangeal interphalangeal, extensor indicius second digit extension wrist extension, abductor bolus longus first digit abductor and extension of the carpometacarpal joint. واللي هي السناف بوكس، extensor bolus longus في الارنر بوردر، extensor bolus longus في الارنر بوردر، والاكستنسور ابدكتور بولس لونجس في الراديال بوردر، والاكستنسور بولس بريفس. بعد كده الراديال نيرف سنسوري سبلاي، ادي الصورة تحته: lateral cutaneous nerve of the arm, skin of the lower half of the lateral side of the arm, posterior cutaneous nerve of the arm, skin back of the arm, posterior cutaneous nerve of the forearm, skin of the back of the forearm, superficial branch, skin of the lateral half of the dorsum of the hand, lateral 2.5 digit including the thumb. Radial nerve injury. Radial nerve can be injured in the axilla, musculospiral groove around the radial neck, radial tunnel syndrome. Radial nerve is compressed at radial tunnel similar to the radial epichondritis. Pain half down arm where it is under the supinator. Interosseous nerve syndrome, radial nerve compression as the arcade of trees. الulnar nerve medial cord of the brachial plexus, nerve root 8 T1, pass behind the medial epicondyle, braces the flexor carpi ulnaris to enter the forearm, superficial to flexor retinaculum, enter the hand by Guylian canal, الulnar canal. الأنا نيرف موتور بورسي دورسال انتروسيال اللي هي الداب، ابدكشن من 2 و3 و4، 2 و3 و4، 2 و3 و4 digits away from the middle finger. palmar interossei abduction of the 2 و4 و5 2 و4 و5 flexion of the digit metacarpal extension at interphalangeal اللي هي الباء. adductor pollicis adduction of the thumb opponent digit minimi flexor of the fifth metacarpal lateral rotation of the producing opposition lumbrical 3 و4 flexion of the metacarpophalangeal extension at interphalangeal adductor digit minimi abduction of the little finger at metacarpophalangeal joint. بعد كده هنقول الالنر نيرف موتور flexor pollicis brevis flexion of the thumb flexor digitorum profundus medial half flexion of the distal interphalangeal secondary flexion of the joint of digit finger and the wrist flexor digit minimi flexor of the little finger flexor carpi ulnaris wrist flexion and ulnar deviation. الulnar sensory nerve palmar cutaneous branch supplies the medial half of the palm. Dorsal cutaneous branch supplies the skin of the dorsal aspect of the medial 2.5 finger. Superficial branches supplies the half and fourth and fifth digit. بعد كده الالنر نيرف ليجن ulnar nerve region cubital tunnel syndrome والnar claw hand وجاين canal compression at cubital tunnel at the elbow paralysis of the flexor carpi ulnaris flexor digitorum profundus hyposenar eminence interossei and third and fourth lumbrical muscles ulnar claw hand hyperextension of the fourth and fifth metacarpal flexion at fourth and fifth interphalangeal due to flexor digitorum profundus lesion is near elbow it will not be present. جاين canal بقى sensory changes and progressive weakness of muscle innervated distal to the side. بعد كده الميديان نيرف formed from medial and lateral cord of the brachial plexus nerve root C5 و T1 descends lateral to the brachial artery enter forearm between two heads of the pronator teres muscle enter hand by carpal tunnel flexor digitorum profundus radial half flexor of the distal interphalangeal secondary flexion of the joint digits finger and wrist flexor pollicis longus flexor of the distal phalanges of the thumb pronator quadratus pronation of the forearm abduction of the pollicis brevis abduction of the thumb في الميتاكاربophalangeal joint والcarpometacarpal joint pronator teres pronation of the forearm elbow flexion opponent's pollicis opposition of the thumb palmaris longus flexion of the wrist lumbrical 1 و 2 flexion في الميتاcarpophalangeal واكستنشن في الانترفلانجيال flexor carpi radialis wrist flexion and radial deviation flexor digitorum superficialis flexion of the interphalangeal joint flexor pollicis brevis flexion of the thumb. median nerve sensory fiber هذا الشكل بتاع الميديان نيرف sensory fiber palmar cutaneous branch skin to the lateral two-thirds of the palm palmar digital branches superficial dorsal tips of the اللي هو دول tips of the first and second and the third finger palmar skin and lateral 3.5 finger. بعد كده median nerve injury pronator teres syndrome hypertrophy of the pronator teres muscle can compress the median nerve pronator teres remain normal but the other muscles supplied by the median nerve are affected. It is sensory distribution heavy hand deformity wasting of the senar eminence of the hand occurred as a result of median nerve palsy. Median nerve is compressed under the flexor and acromion others. Musculocutaneous nerve branch of the lateral cord of the brachial plexus nerve root 5 و 7 motor supply biceps elbow flexion for arm supination flexion of the arm brachialis elbow flexion coracobrachialis flexion of the arm Sensory supply lateral cutaneous nerves of the forearm supply the skin on the lateral side of the forearm. Suprascapular nerve arises from the superior trunk of the brachial plexus 5 و6. motor supply اللي هو infraspinatus lateral rotation and abduction of the arm. supraspinatus shoulder abduction up to 15 degree. subscapular upper and lower branch of the posterior cord of the brachial plexus. motor 5 و6 motor supply teres major lower subscapular nerve actions shoulder medial rotation extension and adduction. Subscapularis both upper and lower subscapular nerve shoulder medial rotation when arm is by side and adduction. lateral pectoral nerve branch of the lateral pectoral brachial plexus 5 و7 pectoralis major medial rotation and adduction horizontal adduction. scapular protraction and depression clavicular fiber shoulder flexion sternoclavicular fiber shoulder extension. بعد كده الميديال pectoral nerve branches of the medial cord of the brachial plexus C8 و T1 pectoralis minor action downward rotation of the scapula scapular protraction and depression ادي اللونجنج of the scapula long thoracic nerve brachial plexus 5 و6 و7 third anterior upward rotation of the scapula scapular protraction and depression. injury can cause wounding scapula. thoracodorsal nerve branch of pectoral cord of the brachial plexus. motor supply بياخد من 6 و8 latissimus dorsi extension adduction medial rotation freedom depression and protraction of the scapula. dorsal scapular nerve from the root of the brachial plexus levator scapulae scapular elevation downward rotation nerve root 5. motor supply rhomboidus minor scapular elevation retraction downward rotation rhomboidus major scapular elevation retraction downward rotation. nerve 2 subclavius branch upper trunk of the brachial plexus 5 و6 motor supply subclavius depress and stabilize the scapula. بعد كده scapular movement and muscle scapular elevation upper trapezius levator scapulae and rhomboidus scapular depression serratus anterior pectoralis minor and major lower trapezius latissimus dorsi serratus anterior pectoralis minor and major latissimus dorsi. del protraction retraction scapular retraction trapezius and rhomboidus scapular downward rotation levator scapulae rhomboidus pectoralis minor scapular upward rotation serratus anterior trapezius and upper and lower fiber. spinal accessory nerve trapezius upper fiber and scapular elevation middle fiber retraction lower fiber depression upper fiber scapular elevation middle retraction lower depression upper and lower upward rotation. sternomastoid cervical lateral flexion and opposite side rotation. superior gluteal nerve superior gluteal nerve اللي هو nerve root الأربعة S1 motor supply gluteus minimus abduction and medial rotation of the hip. ده gluteus medius abduction and medial rotation of the hip. tensor fasciolata flexion and abduction and medial rotation of the hip. ماشي. inferior gluteal nerve nerve 2 L5 S2 gluteus maximus inferior gluteal nerve hip extension secondary action hip lateral rotation and abduction. لاب ماشي. nerve 2 piriformis S1 S2 piriformis action abduction and lateral rotation of the hip. obturator nerve obturator nerve nerve root الاثنين الأربعة enter السايباي passing through obturator canal bifurcate into anterior and posterior division motor supply of the anterior division adductor longus hip adduction flexion and medial rotation adductor brevis hip adduction flexion and medial rotation gracilis hip flexion and medial rotation and adduction. Obturator nerve motor supply of the posterior division obturator externus hip lateral rotation and adduction adductor magnus hip adduction and extension and medial rotation كله كده. Obturator nerve sensory supply cutaneous branch of the obturator nerve supply the skin the middle part of the medial side nervus quadratus femoris nerve root L4 S1 motor supply gemellus inferior lateral rotation of the hip quadratus femoris lateral rotation of the hip. nerve to the obturator internus nerve root L5 S2 motor supply gemellus superior action lateral rotation of the hip obturator internus lateral rotation of the hip برضو ده اللي هو الايه obturator internus L5 S2. بعد كده السياتيك نيرف largest branch of the sacral plexus L4 S3 motor supply biceps femoris knee flexion hip extension lateral rotation of flexed leg non-weight bearing وسيمتندروس برضو knee flexion hip extension medial rotation non-weight bearing برضو سيمن برونوزس برضو نفس الاكشن برضو فليكشن هيب knee flexion hip extension medial rotation flexed non-weight bearing برضو adductor magnus hip adduction extension and medial rotation. بعد كده السياتيك نيرف herniated disc or bone spare that compares the sciatic nerve and causes radiating pain بيعمل كده piriformis syndrome piriformis spasm tightness compares the sciatic nerve. بعد كده الفيمورال نيرف الاثنين الأربعة بس femoral triangle along with the femoral artery motor supply iliacus action hip flexion works with psoas major psoas minor pectineus hip flexion adduction and medial rotation sartorius hip flexion and abduction and lateral rotation knee flexion rectus femoris hip flexion knee extension assistant hip flexion vastus medialis intermedialis lateralis knee extension. الفيمورال نيرف medial cutaneous nerve of the thigh branch of the anterior division of the femoral nerve supplies the skin on the medial side of the lower 2/3 of the thigh. Intermediate cutaneous nerve of the thigh branch of the anterior division of the femoral nerve supplies the skin in front of the thigh. Saphenous nerve branch of the posterior division of the femoral nerve supplies the skin on the medial side of the leg. ماشي. بعد كده التيبيال نيرف terminal branch of the sciatic nerve nerve root L4 S3 superficial muscle gastrocnemius والsoleus والبلانتاريس وديب muscle superficial muscle action plantar flexion and knee flexion soleus plantar flexion plantaris tight knee flexion and plantar flexion deep muscle action knee flexion and lock the knee during initial flexion bilaterally rotating the femur tibialis posterior plantar flexion and inversion tibialis posterior plantar flexion and inversion flexor hallucis longus flexion of the grade 2 plantar flexion and inversion flexor digitorum longus 2 ل5 توس flexion plantar flexion and inversion. بعد كده الحمد لله تبقى النيرف برانش ميديال بلانتر نيرف abductor hallucis first 2 flexion first 2 abduction والامبيريكال metatarsophlangeal flexion interphalangeal extension flexor hallucis brevis first 2 flexion flexor digitorum brevis second and fourth 2 flexion flexor digitorum minimum brevis fifth 2 flexion. Tibial branch lateral plantar nerve motor supply plantar interossei adduction of the second and fifth toes flexion of the tarsphalangeal joints dorsal interossei abduction of the second and fourth toes flexion of the tarsphalangeal joints quadratus plantae flexion of the toes, abductor digit minimi fifth toe abduction and deflection, الامبيريكال 2 و3 و4 metatarsophalangeal flexion, interphalangeal extension, adductor hallucis, abduction of the great toe. بعد كده السنسيشن sensory branches from the tibial nerve and common. ادي السنسوري برانشز اهي. tibial nerve and common peroneal nerve from the shoulder nerve which supplies the skin over the lower posterior lateral leg. medial calcaneal branches supplies the skin over the heel. ادي اهو. وبعدين medial plantar nerve supplies the skin on the medial side of the sole. وبعدين lateral plantar supplies the skin on the lateral side of the sole. بعد كده common peroneal nerve SL4S2 Synthetic nerve and gluteal fossa bifurcate just below the neck of the fibula. Superficial peroneal deep peroneal nerve. deep peroneal nerve root L4S1 base anterior dorsiflexion and inversion. Intersensorial longest toe extension, first toe extension, ankle dorsiflexion and inversion. Sensor digitorum longest toe extension, ankle dorsiflexion and inversion. Sensor digitorum brevis toe extension. Peroneus tertius, ankle dorsiflexion and inversion. Injury to the peroneal result in foot drop and opposed eversion during the gait. ماشي. ال4S2 peroneus longus plantar flexion and eversion. peroneus brevis plantar flexion and eversion. ماشي. الله أكبر الله أكبر. Superficial and deep peroneal nerve. Deep peroneal nerve webbing between first and second toes of the foot on the dorsal surface. Superficial peroneal nerve dorsal of the foot except webbing between first and second toes and anterolateral part of the lower leg. يبقى الديب peroneal nerve اللي هو بيغذي الويبنج سبيس. Superficial peroneal nerve بيغذي الدورسال ما عدا الويب سبيس. شكرا جدا.